St Luke's Hospice provides care and support for thousands of people every year in one of the most densely populated and economically challenged areas of the South East. Founded in 1990, St Luke's Hospice provides direct care for people living with advanced life-threatening illness. Support can be given through all stages of illness, from diagnosis through survivorship, or at the end of life and into bereavement. Such diseases are not necessarily age or lifestyle specific, so our care spans all ages and social groups.
My name's Richard and I'm 61 years of age, and in January of this year I was formally told by my team of doctors that I was going to have to be classed as a palliative cancer patient.
Hello, I'm Shelley. I was diagnosed with inflammatory breast cancer in 2006.
My name's Jackie. I'm 48 and I have motor neurone disease.
Having fought the disease for 3 years, it was a bit of a wrench learning that I'd lost the main battle.
St Luke's offers a day hospice service, which provides the opportunity for people to enjoy the company of other patients, supported by staff and volunteers. Lunch and refreshments are included in the day, which starts at 10 a.m. and finishes at 3:30 p.m.
On the first day I was very reluctant to take part in anything. I certainly didn't want to do craft work, I certainly didn't want to play games with people, and I didn't really want to sit down and talk to them either. I just really wanted to be on my own and away from group therapy. But as the day wore on, I think St Luke's worked its magic on me, and I was beginning to feel more comfortable at home. And probably by the end of the second weekday, I was beginning to believe that maybe this was the right thing to do, and I would be quite happy to come every week.
When it was first brought to my attention about St Luke's, I was very apprehensive, very unsure, very stereotyped, thinking it's going to be full of old people, I'm going to sit around and do nothing. And it's been really the complete opposite.
I've now been coming for 3 months, and hopefully it's going to be a lot longer. St Luke's has given me people that I can talk to. It's given me people that know what I'm going through.
Having someone who has more or less the same cancer as you, really you can talk about all kinds of different things, you know, and relate to things better.
My name is Chris Metham. I'm one of these people with a life-limiting disease, but fortunate enough to come to St Luke's. I was diagnosed with incurable cancer some 2 years ago.
I'm Suzanne and I'm the nurse manager of the day hospice. We have a specialist team, from our palliative care consultant to our specialist nurse practitioner providing medical support. We have a team of specialist qualified nurses as well who provide assessment, ongoing review and support for the patient and their family. This enables us to give a lot of information, support and advice, while being able to monitor patients' condition and give them the support when they need and as they need it.
St Luke's has also given me the ability that on the Tuesday that I come, my wife can then go off and do whatever she wants to do, and from that point of view it's a release for her.
I should repeat the words that my wife used, and that was that when I come home from the day at St Luke's, I've got a smile on my face and something to talk about.
Patients are welcome. Have symptoms reviewed by the specialist nurse practitioner or doctor.
My name's Virginia and I'm specialist nurse practitioner within the day hospice. My role within day hospice is to assess all the patients from a medical and nursing point of view and to try and keep them well. So I see each patient and I spend quite a lot of time looking at their symptoms, their problems. I do a holistic assessment, so we go into things like psychological problems, maybe social problems.
Following medical assessment, community colleagues will be informed of any changes in care or medication.
Dr. Smith? Oh hi, I've just had one of your patients in, Chris.
Patients can participate in diversional activities or enjoy a complementary therapy.
St Luke's has been offering complementary therapies to their patients practically since it opened its doors in 1991. My name is Mary Hutchison and I'm the Nurse Coordinator of Complementary Therapies at St Luke's. I first of all would ask you to come along for an assessment if you're a patient, and we will go through your medical problems and so on and try to fit a therapy around any of these. The therapy would probably last about an hour or so, and we offer therapeutic massage, aromatherapy massage, reflexology and Indian head massage. We also of course include your carers or relatives in our complementary therapy frame, and they can have complementary therapies too. We find that complementary therapies are very, very beneficial to the patient and the carers and the relatives too. It gives you time for yourselves to stop the endless worry and terrible stress and anxiety which is attached to cancer and all of the life-threatening diseases we come across. If you feel that complementary therapies may be beneficial to you and you would like to come along and discuss it, I'd be happy to see you.
If required, transport can be arranged. St Luke's offers over 20 different services, 24 hours a day, 365 days a year, focusing on treating the whole person as well as specific symptoms. Our support for people in the community is far-reaching. Through our Hospice at Home service, day hospice, outpatient clinics together with satellite units at Corringham and Billericay, we are able to extend hospice care and support far beyond a cluster of buildings. In 2011, our Hospice at Home service alone provided nearly 20,000 care visits to patients in their own homes. Here at St Luke's, we seek to support all those affected by the illness.
Hello, I'm Beverly and I'm the social worker for St Luke's. I work in all departments of the hospice but also out in the community, and that could be anything by supporting people to get what they need, advocating on their behalf, or sometimes signposting to other forms of support.
Supporting carers is an important role for the hospice. Any carer supporting someone at home can attend and are invited to a carer support group, which is held the last Wednesday of the month from 7 to 9 p.m. The event is held in the Day Hospice Lounge. Patients known to the Hospice at Home service can request support, which allows the carer to attend and benefit from the group support.
This is an informal group that all carers are invited to. It gives them an opportunity to look around the hospice, meet the nursing team, and also listen to other concerns or questions that other carers may have, which sometimes provides support in, oh, I hadn't thought of how to deal with that, or if something is worrying them. And also an opportunity to talk to the nurses on a one-to-one basis if there's something they're worried about and they may not want to ring up, but it provides opportunity to have those informal conversations.
They're on the same page as you are. They understand. Their situations might be a little bit different, but at the same time they can empathize with my situation. and that supports me as well as having me support them.
Our inpatient unit is a modest size, providing beds for 8 patients. Patients may be admitted at any time during their illness for specialist symptom control and assessment. Care is tailor-made to include caring for the physical, emotional and social and spiritual aspects of a person's life.
Hello, I'm Kim and I'm one of the staff nurses that works on the inpatient unit. We're very much like a little family here, and when patients and their families arrive, they are part of that family for the length of their stay. Every patient has got their own individual bedroom, and most of the bedrooms look out over our lovely garden. We do have a little bit of a routine, but the routine generally centres around what the patients want. So everyone is individual, so if they want a bath in the afternoon, then that's fine. If they don't want their breakfast until 11 o'clock in the morning, that's also fine.
St Luke's values the special days that patients and families enjoy.
All visitors are welcome to make tea and coffee at our tea bar.
Special occasions from birthdays to weddings are celebrated.
I'm Stella and I'm one of the nurse managers of the inpatient unit. We like to maintain a really relaxed and informal atmosphere on the unit, but I think it's reassuring to know and that people and the public do know how well qualified all of our nurses and doctors are. They are experts in their field and we are a centre of excellence.
The unit provides care for all stages of illness, which includes providing end-of-life care.
A lot of our patients are admitted to get their pain and symptoms under control, and once they have improved, they're able to be discharged home again to be with their families and to continue with their lives. Some patients are admitted for end-of-life care, and others come for respite to give both themselves and their families a break.
The Information Resource Service based at Corringham offers an informal, confidential, friendly environment for anyone in our community.
I'm Evanwy and I work at St Luke's House in Corringham, which is a satellite for St Luke's Hospice. We have 3 services here. We have an adult counselling service, a children's counselling service and an information service. We also have a room where complementary therapy and lymphedema services are offered, linked with the services from St Luke's itself.
People can drop in from 9 to 4 Monday to Friday, but may also be referred by a professional.
Hi, I'm Laura. I work for St Luke's Children's Counselling Service. We counsel children and young people up to the age of 18. And we work with anyone who's been bereaved. Sometimes we go into schools, sometimes they come to us. We've got a sort of playroom, and we've got this room here which is for the teenagers. It's more of a chill out room. It's our little wooden hut, we call it. The younger children especially like to do activities, so we have Play-Doh, we have puppets, we have sand trays.
Luke's counselling service for children and young people provides pre-bereavement support. We also continue our support following bereavement. This service is not limited to cancer or hospice-related deaths. The info space at Basildon Hospital also offers a drop-in service.
Hello, my name's Helen. I'm a volunteer for St Luke's Hospice and I work here at the info space in Basildon Hospital Outpatients Department. We give out information here primarily to do with cancer and the hospice services. We get patients dropping in, we get healthcare professionals dropping in, and we're able to give them written information here and we can guide them towards other services appropriately.
I saw this area in the corner called the info space, and a lady came over to me and asked me, you know, how I was and if I needed any information. And from then, I just got involved in the St Luke's Hospice, with different treatments.
The Macmillan Dove Community Counselling Service works over 4 sites at Corringham, Basildon, Grays and Billericay.
I'm part of the adult counselling team here at the hospice. We provide